Good morning, and thank you for the opportunity to speak today. These are my disclosures not relevant to this talk. Achalasia presents, as you know, with a non-relaxing lower esophageal sphincter, which may be hypertensive, and a myotomy of the LES is recommended to open it. Peristalsis also fails generally in achalasia, so an open lower esophageal sphincter may allow the esophagus to empty via gravity. But our surgical dogma teaches us that if you do a myotomy to the esophagus, 100% of people get gastroesophageal reflux disease. So I'd ask you, isn't it a desirable sign that your treatment was efficacious? Now, in trying to decide what to think about reflux after POEM, let's look at our historical data about Heller myotomy. We have published data that shows that if you don't do a fundoplication after Heller myotomy, 100% of the patients will have gastroesophageal reflux. As you know, we disrupt the phrenoesophageal fat pad to do a Heller myotomy. We alter the angle of His. We open the hiatus surgically. These are all things that lead to the development of gastroesophageal reflux. So most people typically do a fundoplication. But if you look at the data, even with fundoplications, a significant number of patients still have gastroesophageal reflux. 41% of patients who have a door fundoplication have measurable reflux. 21% of toupee patients have measurable reflux. We've seen from Lee Swanstrom's series, 33% of people that had pH probes after a fundoplication still had a significant degree of reflux. So even though we think we're doing anti-reflux procedures, they're not necessarily efficacious. So the question is POEM better or worse than Heller for gastroesophageal reflux disease? Without doing a fundoplication, there's certainly concern that the rates may be even higher. So let's look at the data. Some early series looked at both gastroesophageal reflux symptoms, esophagitis seen on endoscopy, and positive pH studies. And you can see the data is a little bit mixed. Symptoms, 12 to 23%. But look at the degree of esophagitis, between 20 and 60%. Positive pH studies, between 30 and 50% of the time. So it does seem like it's a fairly significant issue. A recent multicenter study showed that the presence of reflux was actually the strongest predictor of POEM efficacy. So we know if we get enough of the myotomy done to alleviate the symptoms of achalasia, you're going to give the patient reflux. But assessment of this is complicated by the idea that many of the people with GERD-type symptoms may not have a positive pH study, and many patients with a positive pH study may not have symptoms. So Costamagna has proposed using the term clinically relevant gastroesophageal reflux, patients who are symptomatic and either have a positive pH study or esophagitis found in endoscopy. So in 103 patients, 50% have positive pHs, but only 29% would have reflux after POEM. Here's a new multi-center study that looked at this, 282 patients across 3 continents with 12-month follow-up. Clinical success was right in the same lines that you heard Christy describe. 57.8% had positive Demeester scores, but only 23% had esophagitis. And in this study, the only independent association for the development of reflux was female gender. Here's another new comparative single-center series where they compared POEM to Heller. And as you can see, the esophagitis rate was higher and the pH rate was higher than the Heller. So this study concludes that POEM actually has a higher risk of reflux than Heller myotomy does. Here's another recent study, 105 patients, 70 were followed out for 3 months. They all had anterior myotomies performed. 7% had reflux symptoms at 3 months, so not a terribly high rate. Double that had esophagitis seen on endoscopy, but all the patients were well controlled on PPIs. And they observed in this study that the degree that the integrated relaxation pressure changes does correlate with the risk of developing grade B esophagitis. Here's yet another recent comparative study, 33 POEMs versus 23 Heller myotomies, granted small series, 26% reflux rate after Heller myotomy, but only 15% after POEM. So these authors concluded that POEM actually produces less reflux and therefore is safer and should be considered the procedure of choice for achalasia. This study questions whether or not symptoms are enough to make the diagnosis. Again, it's a comparative study of Heller myotomy versus POEM. Pretty similar rate of symptoms, but more signs of esophagitis, double in fact in this series in the POEM patients, and a significantly higher, 4 times higher rate of pH positivity. So it does say that ambulatory pH monitoring should be the gold standard and make the diagnosis of post-treatment pathologic reflux, but the clinical implications of this are poorly understood. Here's a recent meta-analysis that just came out looking at published series of POEM and Heller myotomy. So significant numbers of patients. The symptom rate was higher for POEM, the acid exposure was higher, esophagitis was higher. So the conclusion was reflux is a significantly worse problem after POEM when compared to Heller myotomy. So we don't have a clear consensus in the literature. There certainly seems to be a trend that reflux is a worsening problem. PPIs are widely used to treat symptoms, but we don't know what the long-term ramifications or implications are of doing that. It certainly does seem to be worse of a problem in POEM than it does in Heller myotomy, so vigilant post-operative follow-up is important, but we really need long-term data to decide if post-POEM reflux will cause excitement for this procedure to wane. So to answer the question of the talk, is this going to be the death of POEM? No, but I think this is a clarion call to do vigilant follow-up and to see what happens to our patients many years after they do receive a POEM procedure. Thank you very much.